Do you want to learn how to get retired, stay retired, and enjoy your life to the fullest? This is the Retire Happy Podcast with certified financial planner professional Jeremy Finger. Jeremy will be your guide to happiness as he discusses the art and science of retirement, breaking down the complicated information to help you make good financial decisions without worry or burden. Now, on to the show.
Hello and welcome to Retire Happy with your host, Jeremy Finger. Jeremy, what's going on?
Oh, I was just living life and helping people make good decisions, hopefully.
Yeah, you helped me make a good decision by being here.
Oh, well, ain't you sweet? Aren't you sweet?
That's what you pay me for.
That's right.
Yeah. So I know you've got a guest on the show today. Who did you bring on the show?
Oh, we really have a great treat here today. We've got David Seiger. He is a long-term care and health insurance expert to help retirees and newly minted retirees make some good decisions when it comes to long-term care, when it comes to making decisions around Medicare, and going over all the variety of different options available.
All right. Well, I'm excited to hear what you guys have to say.
Wonderful, wonderful. Thank you. David, welcome. I appreciate you being on the Retire Happy podcast here, and long-term care expert, Medicare expert, and an attorney. So I think you've got a lot of bases covered. And so if we're thinking about someone who's 55 and older, looking to get retired, stay retired, and make some good decisions when it comes to making some healthcare options or healthcare choices, that can be
daunting.
What's that? Yeah, exactly. So where would you like to begin? There's a lot of we could cover, and we're going to try to get as much as possible. Where do you think we should begin here?
Well, thank you for having me, first of all. I appreciate the opportunity to be here and talk to your guests. I think the first thing that you kind of talk to your clients about is the cost of 10 years of paying for health insurance. Mm-hmm. They're 10 years away from 65. You have to be 65 to receive Medicare benefits unless you have some other issues, disability or whatever. Mm-hmm. But, the first thing I tell people that want to retire early is, okay, so you're coming off of a group plan. Did you talk to your HR about utilizing COBRA? Because COBRA is basically your own health insurance. You're just paying for it. COBRA benefits are typically better than what you can get out on the marketplace. They're often, believe it or not, cheaper than what you can get out on the marketplace. I just had a lady in my office. I think she's 58. Her husband's 65 already. He's already a Medicare client. And I said, you're talking about 8 years of paying $800, $900 a month for coverage. Is that affordable to you? And are you sure you want to retire? Well, she said, I've got 100 people under me and I'm just stressed out. I said, well, she works for a big company. I said, is there a way for you to take a less stressed job and keep going? And she said, maybe, I'm thinking about that. And I said, well, what are you going to do if you retire? He's retired already. She said, well, he's busy all the time. I think I would just go crazy. Well, these are ideas that you have to think about. And I really caution people, especially with planners, to make sure that they have that money there to be able to pay those costs. Yeah.
David, great point there. I've written a blog on Retire Happy, but with training wheels. Instead of full-time, going part-time, or just going to your employer, because this lady here has built up a lot of experience in her job, and maybe she, instead of working 40 hours a week, doing some of the things that she doesn't want to do, how about working 20 to 30 hours a week, doing only the things she likes to do?
And hoping that the employer will pay for that, meaning you'll keep the benefits going.
That's right.
My wife works part-time and there are no benefits.
Yeah.
So even though she's working 20, 25 hours a week, they hire these women, or sometimes men, but mostly women who want to work part-time, and they don't have to pay benefits, which is great for the company.
Right. But it does put the onus on the insurance on the person.
Correct. The other thing I say to people is often check with your benefits specialist and see if you can take with you your vision and dental. People talk about vision and dental all the time. And I'm like, well, what I can get you out on the street is not as good as what you've got right now through your employer. And often it is separate from their health insurance. They just have to keep paying for it.
Okay. So so walk me through that process. Like so they can keep their you said health and
their vision and dental.
Vision and dental. So how do they go about doing that?
Well, it's separate from their health insurance. It's an add-on. They may even be paying for it now, or maybe maybe the employer's putting in a couple of dollars a month or a week, whatever it may be, and they just have to pick up those premium payments. But when I'm talking to people turning 65 and retiring, let's just say,
sure.
Often they say, well, what about vision and dental? I'm like, well, you like your vision and dental right now? Yeah, I do. Well, talk to your benefits person in your office and see if you can take it with you. It doesn't matter to them. Sometimes it's an accounting issue. It's a payroll thing, but often it's like, yeah, you can take it. You just keep paying for it.
Okay. So you can, so they may, force you to take COBRA, and we'll go into COBRA is in just a second, but you may be able to keep, and let's just say in this lady's instance, it's 6, 7, 8, 9 years of vision and dental.
Yep.
Okay. I didn't know you can separate that. So to talk a little bit about COBRA, what it is, and how would somebody go about seeing what the cost would be with COBRA? And then, have you found there's other instances where it may be less expensive to go into the marketplace?
Right. So it's a great question. So COBRA is basically government saying you can keep your current health insurance for 18 months and you have to pay the premium for it. COBRA benefits are exactly what you had before. So the deductible might be a little bit less. It may be more benefit-rich coverage rather than going to the marketplace. So the marketplace is, bronze, silver, gold. Everybody has the same plans pretty much, but you could go on the marketplace or you could go off the marketplace. If you go on the marketplace, you might get a subsidy based on, or depending on your income level and how many people are in your household. That is a tax credit. And it is figured out when you file your taxes. It's figured out, it's determined by the IRS. But typically the bronze, silver, gold, they're not great plans, but they may work out for that person. So what we do is we sit with the person and say, okay, we're going to look at your COBRA plan, bring that information in, and we're going to run you a marketplace plan too. And let's see which one comes out best. Mm-hmm. Over the last couple of years, I've seen that COBRA is typically better. Often it's better. It may be just as expensive or maybe a little bit more expensive than what's on the marketplace, but their benefits are so much richer. So you have to make that determination. In 18 months, you can go on to the marketplace after COBRA's done.
And when you're using the term marketplace, that's what it's actually called.
Yep.
Is an area where someone who is trying to bridge the gap to Medicare, it's called the marketplace.
Well, right. The health insurance world, if you're doing an individual plan, not a group plan through your employer, you can go on the exchange, the ACA, which might give you some subsidy, or you could just go to your own United Healthcare, Blue Cross Blue Shield, whatever it is that's in your county, in your state. You can choose to do that and not go on the exchange. The exchange may give you a subsidy. It means that it's tied to your tax return, your income. Going to the marketplace is basically the same plans as the exchange, and it's just coming from you're going direct to the company. You're going direct to Blue Cross and Blue Shield. You're going direct to whoever your carrier is.
Okay. So
there's no subsidy.
I've got a few different questions. All right. So I think, COBRA is being able to continue the healthcare coverage from your current employer for, I think, 18 months.
Correct.
Okay. And then after 18 months, the retiree, the wonderful listener, is have to look at other type of healthcare options.
Correct.
One, you've got the marketplace, which you said you got bronze, silver, gold, kind of like the Olympic medals, right? Yep. And then, but there's also another option where they can go directly to Blue Cross Blue Shield, or
they can. That will not be tied to their to their tax return, to their income,
Okay.
there will be no subsidy.
Okay.
Most people won't have, I don't say most people, a lot of people will have too much income to get a subsidy.
That's
anyway.
right. That's right.
So
So can you kind of go over like what it's like to, let's talk about the bronze, silver, gold, and then what type of income would you need to have to start getting some subsidy or it making a difference?
It does. It depends. It depends on how many people are in that household, how many people are filing taxes. You've got a 30-year-old daughter who's living in the house but making money. She files her own taxes. That's not part of the equation.
Okay. So let's just say typically husband, wife, like what are we looking at here?
Well, I actually ran something for the people in South Carolina, a guy, a 60-year-old. I didn't put in any income. I just put in a 60-year-old non-tobacco, Horry County, Blue Cross and Blue Shield of South Carolina, a bronze plan with a $7,900 deductible.
Okay.
Maximum out of pocket, $8,550. Okay. There is a $683.26 monthly premium estimated, and I didn't factor in any subsidy. Okay. Because I don't have an income. Meaning I don't know what the income level, I wasn't sure what to put in, but
sure.
You're talking about, that's a basic low end plan with no subsidy. They could do, if the person has, let's just say, a spouse not making an income and they've got a low income, they may end up with a $200-$300 subsidy a month.
So when you say in subsidy, like in this particular case,
it's a tax credit.
Okay. Tax credit. Okay. So
we use the word subsidy.
Oh, all right. Yeah, okay. So in other words, instead of it really kind of costing him $600-$700, when you take out the subsidy or tax credit, it may cost him $300 or $400.
Correct. Right.
Okay.
But that's the determination that has to be made, and we don't actually make that determination. I mean, we can give you an estimate, but that's really once again based on your income and how many people are on that plan, how many people in your household. So that's going to be made. That's going to be determined at tax time.
Okay.
Here.
So, but you, like, part of the things that you do is you're walking the couple through what their options are.
Yeah.
Do you have to look at their tax return, or do you, ask the client, hey, what was your adjusted gross income?
I ask.
Yeah, you're going to ask.
People don't really love to give you their tax returns.
Well,
I'm not an accountant either. So
yeah.
Well, they have an accountant, and you can talk. They can talk to their accountant about it as well.
Sure. And let me back up a second. So David and his team at Burns and Sokol helped some of our clients make these determinations. We work together to help the client decide what type of plan is best for them. Okay. Now, fortunately, David, what we do as part of our process is get the tax returns.
Right.
So we're working off of pretty good numbers here. And so you help us help the client determine what the best type of healthcare plan is. And then from the cost standpoint, when you give that cost information back to us, we run that into the overall plan and decide, hey, if your income is this, it's going to affect your healthcare insurance down the road. And it's also basically, you want to know, can you get retired and stay retired?
Right, exactly.
and to do so the most tax efficient way possible.
Right. And Jeremy, we, in our office, we love working with financial planners. You have all of the information, all the financial information on that client that would be helpful to make a good decision. And I work a lot with financial planners. I also work with life insurance agents or health agents. And honestly, they don't have the same information, as much information, the breadth of information that you have. Mm-hmm. And so I encourage people all the time you must see a financial planner. You can't do this on your own. And your accountant's going to be helpful, but they're not going to be able to tell you everything you need to know. And often financial planners file taxes for people. So when I get a client in the office, they're often coming as a referral from a financial planner. And I appreciate that. And we work hand in hand with them. When you say, what's the subsidy? What's the final cost? It's hard to determine without more information.
Yeah.
We'll look at both options, all three options. So we've got the COBRA option, which I encourage.
Okay.
Number two is we've got the exchange, or just going to the marketplace, which will be the same it's the same plan as what's the silver, bronze, silver, gold. But you're just going direct to the insurance.
Is there any cost savings going direct, or is there any big difference between going to like what you call the exchange versus the marketplace?
You aren't going to get a subsidy, but you may not anyway. So if somebody's got a big income, well, all right, what do I need to go to the subsidy?
Okay, so if you're not getting a subsidy, you can go direct. And do you save any money going direct?
No.
Okay, well, it doesn't. I mean, if it's not going to save any money, what's the big deal?
Correct. That's right. When I say direct, you would use an agent, or you would just call the company's 800 line to enroll. They've made it so that you don't necessarily need an agent, but an agent can help you look for different companies. How about that?
Is there any? Okay, that begs the question here. Is that so? Are they saving any money if there's no agent? No, it's the same. Mm-hmm. So why not take the escalator versus the stairs?
Right.
I mean, really.
Right.
Yeah.
What's the escalator? No agent or agent?
Well, I
don't know which one's which. You tell me.
Well, I mean, I would tend to say is like if the agent's helping me make a decision while I'm out on the golf course or spending time with my kids or grandkids and helping me navigate that burden.
Yep.
Great. That's the escalator.
Absolutely. I agree.
Yeah. I mean, am I going to sit there on Google and research all this stuff and look at this stuff and read these things and ask these questions? Or I can say, hey, David, this is me and my wife. Yep. I'm 60 years old. I'm 62 years old. This is what we make. What do I need to do? Right. And you being able to cut through that clutter and help us make the right decision. And hopefully, I mean, if you're clients of Riverbend, we work in conjunction so that, we're jointly making some efforts here to help you make that good decision and you can live your best life.
Well, I think you bring up a great point that I didn't even expect that we would talk about. And that is often people say, how do I pay you? And I'm like, well, I get a commission. If you buy something for me, I get a commission. It's built in. It's the same price as if you went direct to the home office and did it. It's the same price. Often it's regulated. Certainly in the Medicare sphere. And people say, well, do I need to pay you? And no, you can't pay me on the Medicare side. I get a commission that's the same commission, whether it's an Advantage plan or a supplement. There you go. It's the same thing. I have no vested interest in one company over the other.
Right.
That's a good question that they ask. I'm sure they ask you that as a financial planner.
Yeah, they do. Yeah, no. And that we certainly go over that. In your instance, though, it's like the costs are the same. It's just you're choosing to do the burden yourself or not do yourself. And it's like, hey, if I can take the escalator, I'm going to take the escalator.
Absolutely. I agree.
I did do a run this morning. So, I mean, maybe I need to take it for my own health.
Yeah, right. Right.
But so how does this, we talked a little bit, I guess, in other words, there are options and there's some credits that may come back to the client if they're trying to get some healthcare insurance prior to Medicare.
Correct.
Okay. Let's suppose, for instance, they're coming up on their 65th birthday.
Yeah.
Okay. What does someone need to do? And then what are the deadlines? What are the things that they need to think about as they're getting close to age 65?
Okay. So if they're not retired, if they've already retired, let's say that, have they taken Social Security already? Are they already taking Social Security? If they're taking Social Security, then at 65, they'll be enrolled in Medicare, original Medicare Part A and B. If they're still working, they may not want to go on to Medicare yet. The employer may say, hey, you can stay on our employer plan. That's great. If the employer says, no, we want you to go on to Medicare, they will have to apply for Part B with Social Security. Part A is hospital nursing home. Part B is doctors and procedures, things like that. Okay. So Part A, they get automatically at age 65.
Mm-hmm. I know they don't have to do anything to get that Part A. Nothing. Now, what if someone's not? Well, we'll get into not working in a second, but
right.
If they're working, they automatically get Part A at 65. They don't have to do anything. No sign-ups, no nothing.
Nothing.
Okay.
Part B, let's say they're 67 and now they're ready to retire. And the employer says, okay, you're ready to retire. So then at that point, they would apply through the Social Security Administration, either online or make an appointment. During COVID, the offices weren't open, so everybody's working remotely, and they would just go online, or they would call their office and say, okay, how do I do this? And they will, there's a form they sign up. And then there's a second form that the employer will help fill out and sign that shows that the person had creditable coverage.
Oh, yeah. Because otherwise, if they don't have coverage and they turn 65, I mean, there's a penalty involved.
There's a penalty, right? So They have to have had creditable coverage, and creditable coverage is really for the prescriptions, that they had coverage for prescriptions that would be at least as good as what Medicare would cover.
Okay.
So you do that for both spouses. So let's say wife is the primary, she's the one that's still working. Let's say he's retired already, but he's still on her plan. She goes to Social Security, applies for Part B, and then they will have to file a form for both of them that they had creditable coverage. And what I found in the past is if they don't follow up really well with Social Security, often that form gets on her. They have it for her, but somehow it gets lost for the spouse. So they have to make sure that it's there if this is their job. This is their new job, is to really apply for Medicare and then manage their Medicare. And I'll get into that in a minute. But that's what they really have to do, is apply for Part B. Part B is a cost item. Part B is actually going down next year in 2023. It was $170.10 this year, and now it's gone down to $164.90 a month.
Okay.
So they do have to pay for Part B, no matter what kind of Medicare plan they have. But they should go to Social Security 2-3 months in advance, if they can, for a specific effective date. So let's say they're retiring December 31st. They're going to want a 1/1/2023 effective date.
Okay. All right. But this is if they're an employee. Okay. A couple questions. If the employee is turning 65, is it the employer's responsibility to let Medicare know that they're covered, or that there's no action needed by the employee? Is that what you're saying?
No. So the guy's 65, he's retiring.
Well, let's just say he's not retired. Let's say he's going to work to 67.
Okay. Are they still on, and the guy's still on the employer plan?
Yes.
They're not doing anything right now.
They don't need to do anything. Does the employer need to do anything to let the Social Security? No, it's only when the person goes to retire that then they need the employer to let the Social Security Administration know, hey, no, we've got Mr. Billy Bob covered. We had him covered for the past 2 years.
Correct. Because Mr. Billy Bob is actually applying for Part B at this point.
Okay.
Because he's already got Part A. He's down
because it's automatic, because Part A is automatic.
Correct.
I got you. All right. Okay. Perfect. And so let's just say 67.
Yep.
Right. That you would help the client, do these types of things.
Yes and no. I provide them with the forms. Social Security does not want to hear from me. So no, I direct them on how to do. I help them, handhold. I call them like, okay, have you followed up with Social Security? No, call Social Security. Ask for a manager. Find out where those applications went.
So they fill out a paper form and they mail it in, or
they can do that, or they can do it online.
Or they can do it online. And they're submitting this form so that they can get the B coverage starting in this particular example for 2023.
Correct.
Right. All right. So what other types of coverage might they want to consider D?
Okay. So let's go back a second before we get to C and D. There are, I don't want to say a penalty, but there's a price for being successful in life, financially successful. So the Medicare looks back at a person's tax returns 2 years.
I knew that's what you're going to say.
Right. So it's called IRMA, and it is I don't want to say a penalty. They will, if they have certain levels of higher income, they will, both husband and wife will pay more per month for Part B and for Part D. That's their prescription drug plan. So that's the way it is. That is not coming from the insurance companies. That is coming directly from the IRS, from the Medicare. That's the way it is.
That's right. So like when we're doing tax planning for clients and we're doing, let's just say, taking capital gains or Roth conversions or whatever it may be, we're looking forward a couple years to see how it would affect their IRMA.
Correct.
Yeah.
So that's something that is out of an agent's hands. It's a separate bill that will be, that will come to their house, and they can pay it quarterly, they can pay it up annually. That doesn't matter. But yes, that's important to know, especially for your clientele. So let's talk about Medicare Part A and B. That's Original Medicare. Original Medicare is a great plan, but it does have some gaps in coverage, some deductibles, some co-payments. And so often what people do is they decide to take either a Medicare supplement policy that would fill those gaps. Sometimes we call it a Medigap policy, which they will pay each month. They'll pay a premium for it. And then they're required to have some prescription drug plan, which would be a Plan D, a Part D. Okay. If they have no medications that they're taking whatsoever, they still need a Plan D, because if they have more than a 63-day gap in coverage, there is a penalty that they will pay for the rest of their lives when they do go on to a Part D.
Wow.
So often I'll get them a policy of Part D that's $5 a month or $7 a month or $11 a month. It's worth paying for, even if you have no medications. Yeah. No prescriptions, fine. Okay. Just so they don't have to have a penalty down the line.
Yeah, that makes sense.
Okay. So supplement is there. Let me tell you how good these are. Medicare is a completely different animal from health insurance under 65. It is an incredibly benefit-rich plan. It's a different animal than what you're used to, and I try and help them understand that it's like nothing they've had before.
Really?
So, yeah. When I do supplements with people, typically do a Plan G, which has this year, a whopping $233 deductible. That's it. And then the rest of it is pretty much covered. They can see anybody they want who takes Medicare. They can go anywhere in the United States and see anybody they want that takes Medicare.
Really?
Yeah. It's a great plan. It's also $100, $120, $150 a month per person, and it goes up as they age. But that is the Cadillac plan. That's the Cadillac out there. Okay. They can choose that with a Part D, a prescription drug plan, or they can go to a Part C, which is a Medicare Advantage plan. And a Medicare Advantage plan started in the last 10, 11 years. They are actually great plans. They are basically going to a separate company. They're giving up their Medicare Plan A and Part B, basically, and going to a separate company that Medicare is paying the premium for. And they get everything that Medicare Part A and Part B will give them, plus a drug plan within there. Plus, they have some dental, they have vision, they have health and wellness built in. They have help pay for over-the-counter things. Okay, they're really great plans. Here's what they are. They're typically an HMO or a PPO. So you are now.
So you're limited on who you can go to for.
Correct.
That's right.
Correct.
Okay.
Correct.
All right. So
here's the beauty of it. It's typically $0 premium or low premium. But every time they have a procedure, every time they see a specialist, every time they have a test, there's a copay.
Okay. What's roughly the copay generally?
It could be $35 for a specialist. It could be 20% of the cost of the procedure. It could be whatever. It depends on the plan.
Okay.
So
and you're also limited. Yeah. And you're also limited on who you can see. Whereas the other one, where you have A and B, and let's just say that the supplement, you're free to go to see whoever you want.
Correct.
Right.
So every year we ask them to give us who their doctors are and what their medications are. And I look up every doctor and every medication to make sure that at least most of their doctors are in that company's plan, not a supplement, but an advantage plan. So it could be Aetna, it could be Anthem, it could be Blue Cross Blue Shield, it could be United Healthcare. Whoever has the most of their providers in network, that's the one we go with.
Okay. But it also, let's just say if someone travels a lot, and I'm just thinking of scenarios here. Because you said in one thing I liked about what you said about the G, supplement. The supplement is that, hey, you can go to anywhere in the country and you're covered.
Yep. You know? So if they are just traveling and not snowbirding, I'm up north, so we have a lot of people who travel down to Myrtle Beach or to Florida.
You're the only one left up there, okay?
That's about it.
You're in a building.
By the way.
That's well. You're the only one in the whole building there. Everybody is now in Myrtle. I'm just saying, everybody is down here.
It's probably true.
Yeah.
I've been to Myrtle Beach in January and February, and it's a bunch of Canadians. Yeah. And everything's closed up. It's like, but it's beautiful, Yeah,
anyway. It's still cold, but now things are not closed up because everybody's here and everybody wants to go do their thing. But
so I ask people, are you snowbirders? And if that's the case, I get them a plan that covers them in Florida and in Cleveland.
Oh, okay.
Okay. There are companies, there are plans that will cover you in other places. That's number one. Number two is if you just travel, hey, I'm going down for vacation for a week in Florida. Okay, and you have a medical emergency, go to the emergency room. That'll be covered. Don't go see a doctor, go to the emergency room.
Okay.
So you're right. There are some limitations, but I'm not paying my Part B premium plus my Medicare supplement premium plus my Part D premium. I'm paying for an advantage plan. I'm going to pay my Part B. I always have to pay my Part B, but I might have a $0 per month plan. So, and I might be pretty healthy. I don't have any real, I see my primary once a year. It costs me $5 or $0 to go see the primary. I don't have very many testing. I'm going to go for an advantage plan.
Okay. And this is what you do. I mean, you ask them questions about how they live their life and, what their expectations are and, what their health is. And, hey, you guide them on making the right decision.
Yep.
Yeah. Mine is pretty much what we do.
Yeah,
and hey, that's right. That's right.
Yeah.
And okay. That makes sense.
Look, I'm used to it on the long-term care side. I've been a long-term care specialist for over 25 years.
Okay.
And I am different than most agents. I ask them, okay, do you have a home that has a first floor bedroom and bathroom? No, I have a colonial. Well, okay, is that your age and place home? Is that where you're, I like it. I think I'm going to stay, or no, I'd like to go somewhere else. I'm going to downsize. Okay, we need to talk about that. Number two, do your kids live nearby? Do you have any kids? Is this a second marriage? Do you have a significant other? Those are all good questions because we have to know what the plan is for them. No one in 25 plus years has ever said, I want to go to a nursing home.
Yeah.
So I'm used to asking these sort of touchy-feely questions. Have you talked to your kids about what you want to happen should you become chronically ill? They're going to make decisions. It'll be easier for them to make decisions if you've already told them what your wishes are.
Yeah. Yeah, that's right.
So these are things that often, financial planners will ask. The problem where financial planners kind of fall down is sometimes they don't want to get into the weeds of what's actually going on in their health. Yes, I have to know if the person has Parkinson's, but I don't want to know if they've got a venereal disease. It's like, and I've heard that from people. One of my planners said, it just changes it for me. It changes the relationship. I just can't handle it. I don't
Right.
know if they have an STD. I don't want to know.
Well, what I tend to do is just make sure that they know what they need to know, and they're aware of who to contact to help walk them through those steps. Hey, if you don't want to do X, all right, great. I want you to know the pros and cons of not doing it. All right.
Correct.
So can you talk a little bit about, I mean, we've got a few more minutes left, but
Sure.
Can you talk a little bit about long-term care and some of the decisions that retirees may need to make, or at least be aware of? Like if one spouse is healthy and the other one's not, and they're not qualified nor have the strength or the time or effort to be able to take care of their spouse if they need care. Can you kind of go over what some of the options are?
Sure. So let me make a distinction between Medicare and long-term care. Medicare is health insurance for seniors. That's basically it, and it will pay for a nursing home stay no more than 100 days.
Okay.
All right. And if that's the case, if the person's in a nursing home, it has to be acute care, meaning it's rehab, basically. Okay.
Right.
So they'll pay the first 20 days at 100%. The next 80 days, the patient has to pay per day unless they have a Medicare supplement policy, which would fill in those gaps. But after day 100, it's over. Long-term care insurance is for somebody who is chronically ill, which means they cannot perform 2 of 6 activities of daily living certified by their medical professional to last at least 90 days or longer. So you got your short-term care with Medicare. Long-term care is anything above 100 days.
Mm-hmm.
90 days, really. So anything past that.
Okay. So how does someone pay for it? What's the deal?
Right. So and it covers somebody who's got a physical ailment, they can't bathe, dress, toilet themselves, or a cognitive impairment, which means they're not oriented to person, place, or time. They've got an Alzheimer's, a dementia, something that they're not safe being left in their own environment. And that is going to pay for the day in, day out care that somebody would have to hire somebody to come in and take care of them. Yep. Or pay for a nursing home or an assisted living facility or an adult daycare, anything like that.
Well, so I'm going to tell you right now is that my dad had a stroke and my mom is a registered nurse and she helped take care of him, but even she needed help getting out of the house. I mean, getting her hair done. I mean, all kinds of things. And it was that he lived for 2 years like that. Yep. My aunt, just what you just said, mm-hmm. she fell, I think, and broke her hip and went to rehab for, I don't know, 60, 80, 90 days. And then found that the nursing home gave her a bit more freedom because it was a lot easier to be social. Yep. A lot of other things there, but you know what? It was not inexpensive. It would cost $8,000 a month. Yep. And I mean, it wasn't cheap. It's not cheap. Home care is not cheap. Home care is actually used to be that nursing homes, the inflation rate for nursing home was 5-6% a year. That's flip-flopped after COVID. Now home care is the one that's got the 4-5-6% inflation rate, meaning it's costing more every year to have home care because they can't find personnel to go into the home. That makes sense. It's a real problem. Right. So, this is stuff that you are putting into your plans. What if one of you or both of you has an $8,000, $9,000, $10,000 a month care need? Right. How long is that money going to last? Right. If we can have some company put in $4,000 or $5,000 a month to help cover that cost, it's going to slow the burn of those assets. I talk about slowing the burn of the assets. And let me tell you, I have financial planners and professionals who call me all the time and say, can you just run me a quote for $7,500 a month of benefit, $250 a day, 5-year benefit period, and an inflation rider, 3% inflation rider. And I'm like, you are never coming back with an application because it is too darn expensive for anybody to want to afford. So we try and bring them down, take them off the ledge. You will always have an income. You will always spend that income. What we're trying to do is make sure that, number one, the spouse has enough income to live on, and that we're not depleting the assets
that quickly. So even if we have $3,000 a month, $100 a day, $150 a day coming in, and your cost of care is $300, hey, that's better than nothing.
That's right. So in other words, like if something were to happen, how can we cushion the devastating blow?
Correct.
Right.
And so what you've lived through is what most of us are going to live through. Most of us will need care at some point in our lives. And when I sit in front of a couple, I always say to the husband, what happens if either of you needs care? And he goes, well, put a pillow over my head. I told her to take out the gun. I said, that's very funny, but it's very nice, but nobody's going to jail for that. Thank you.
Yeah.
But the wonderful reaction that I get from the wife is, what an idiot. Really, come on. The wife usually understands that she cannot lift him today. She isn't going to lift him in 20 years when she's 85. Yeah. Okay.
There's touchy things that need to be discussed to make sure everybody's has understanding of what can happen.
Correct.
So, David, we could certainly talk for another few weeks.
Yep.
And really not cover everything.
Yep.
But you certainly have helped, some of my clients make some good decisions. If someone had questions about anything in this regard, how would they get in contact with you?
They can certainly email me or call me, david@burson-sokol.com. Mm-hmm. Or they certainly can call you, and you can call me either way.
That's right.
Yeah. It's interesting because people say, well, I want to refer you. Can you call this person for Medicare? And I'm like, I can't call anybody. They have to call me.
Okay, great. So, what's your number?
My number is 216-464-1542, extension 121. Or we have an 800 number, 800-543-6000, and hit 121, and that's me.
Perfect. David, thank you so much for sharing your knowledge here today. And we really do appreciate your insight, and thank you for joining.
Thank you. I appreciate it. And if you want me to come back, I'm happy to do it.
Happy to do it, buddy. Actually, happy to do it.
Thank you.
Gentlemen, this has been fantastic. David, thank you so much for being a great guest. Jeremy, thank you for hosting this show and bringing great information to the clients and to the listeners. I will tell you, I knew that you and I were pretty much aligned. I didn't know you were an escalator guy. I choose the elevator because I'm way more lazy than you are. and just the vision of actually on the stairs, even though they're moving for me, it's too much exercise. So I'll stick to the elevator. But anyway,
well, guess what? I'm a cyclist, and people are like, I go the flattest route. I'm like, give me some hills. I want to be challenged. I don't flat is boring.
All right. Well, now you just showed both of us up. Yeah. Thank you, David. I appreciate that. Jeremy, again, thank you. And of course, our last thank you always goes to you, the listening audience. Thank you so much for tuning in and listening to the Retire Happy podcast with Jeremy Finger. If you have not subscribed to the podcast yet, please click the subscribe now button below. This way, when Jeremy comes out with a new podcast, it'll show up directly on your listening device. And we humbly ask that you share this podcast, rate it, and leave a review, as this actually does help others find the show. Again, thank you so much for listening today. For everyone at Riverbend Wealth Management, this is Eric Johnson reminding you to live your best day every day. And we'll see you next time.
Thank you for listening to the Retire Happy podcast with certified financial planner Jeremy Finger. If you have any questions, please visit us at www.riverbendwealthmanagement.com or call us at 843-970-1043. And remember, click the subscribe button below to be notified when new episodes become available.
Investment advice offered through Stratus Wealth Advisors, LLC, a registered investment advisor doing business as Riverbend Wealth Management. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.